Hi, this is Dr. NIKAM from Sugarland Heart Center. Welcome to a presentation on health insurance for people with pre-existing condition. Unthinkable, you say? Think again. Now you can. This is a community awareness project brought to you by Sugarland Heart Center in collaboration with Rachel and Ramya from Hightower High School Medical Academy HOSA program. Rachel and Ramya, welcome to the program.
Thank you. Thank you.
Before we proceed, let's talk about Mr. Katani. Mr. Katani is a 45-year-old gentleman who presented 3 years ago with chest pain. He was rushed to the medical center where he was having an acute heart attack. He underwent cardiac catheterization and subsequently he had to have emergency cardiac surgery, which costed him well over $100,000. Unfortunately, he did not have insurance. He had to forego most of his savings to pay for the hospital bills. But thanks to the new insurance plan, now Mr. Katani has health insurance despite having history of heart disease, diabetes, and hypertension. Mr. Katani is not alone. There are 47 million people in this country who do not have health care insurance. And interestingly, 80% of these people have a working member in the family. Even those people who can afford to buy insurance, they may not be able to do so because of pre-existing conditions such as hypertension, diabetes, or cancer. But thanks to the new law set by the United States government, we have a new insurance called the PCIP, or Pre-Existing Condition Insurance. So to discuss this, I have Rachel and Ramya. Let's start with Rachel. Rachel, tell us about this PCIP insurance.
The Pre-Existing Condition Insurance Plan, or PCIP, was introduced last year by United States Health and Human Services for the multitude of people who have been denied health coverage due to a medical condition. It provides many health benefits, including treatment for pre-existing conditions, and doesn't charge extra because of a medical condition or decide eligibility on income. The U.S. Department of Health and Human Services, with the help of the U.S. Office of Personnel Management and the U.S. Department of Agriculture's National Finance Center, runs PCIP in 23 states and the District of Columbia. The federal government contracts with a national insurance plan to administer benefits in those states. In the other 27 states, there are state-based programs.
Thank you, Rachel. Ramya, tell us something about what kind of requirements are needed for people to be able to get this kind of insurance.
To be eligible for this program, you must meet certain requirements. You must be an American citizen or reside in America legally. You must have been without health coverage for at least the last 6 months. This includes any insurance that doesn't cover your medical condition. You must have a pre-existing condition or a health problem that has been denied health coverage.
Thank you, Ramya. Now let's talk about what kind of coverage this insurance provides. People may be dubious about the kind of coverage they're going to get because of the pre-existing condition. Rachel, tell us something about what kind of coverage this insurance have.
Well, PCIP covers a wide variety of health benefits, which include primary and specialty care, prescription drugs, hospital care, and most importantly, any treatment for pre-existing conditions. All PCIP plans provide preventive care paid at 100% without a deductible when you see an in-network doctor. Full coverage also includes annual physicals, flu shots, routine mammograms, cancer screenings, maternity, durable medical equipment, skilled nursing services, mental illness, emergency services, and outpatient diagnostic studies. For any additional care, you will need to pay a deductible before PCIP can pay for your health care and prescriptions. After paying the deductible, you will need to pay 20% of medical costs in-network. To top it off, there is no lifetime maximum on the amount of money the plan can pay for your health care.
Rachel, that's very interesting because a lot of these even best private care carriers, have so many stipulations. They don't cover preventive care. They don't cover out of hospital services, things like that. But interestingly, this insurance covers a whole variety of services inside and outside the hospital, including medical equipment. So looking at this, I think the premium must be like out of sight, because people with high risk medical conditions have to pay 2 or 3 times the premium. Ramya, tell us about what kind of premiums people have to pay for this kind of extensive coverage.
The premiums are very reasonable. There are 3 different programs that are offered: the standard plan, the extended plan, and the health savings account plan. Here are some quotes for Texas residents based on the type of plan. For example, an individual with a pre-existing condition at age 60 would have a premium ranging from $426 to $572 per month, which is considerably less than the premiums they would get charged if they even managed to get coverage from any other insurance program. The maximum out-of-pocket expense for services in a 12-month period is only $5,950 if you are in-network, and $7,000 if you get out-of-network services. The deductibles vary by plan and on whether the care is in-network or out-of-network.
Ramya, that sounds amazing. Looking at this number, I've been a doctor for more than 30 years. These premiums look like they are considerably less than what most people would pay if they have a pre-existing condition, even if they could ever get into a high-risk pool in Texas. This is really encouraging, and this is very promising. I'm so excited. How do people apply to get more information or apply for this particular insurance? Rachel, tell us something about how they can get more information about this insurance.
The application process is actually very simple and hassle-free. There are 3 options of applying: online, on the phone, or by email. To apply online, go to the website www.pcip.gov and click on Apply Now near the bottom of the home page. It will provide more information through the rest of the process. To apply through the phone, there is a phone number available on the website that will allow you to reach the PCIP facility. The number is also available below in the contact information. And to apply by mail, go to the website and click on the tab How to Apply. The instructions are available. It requires printing and filling out an application in English or Spanish. You can also reach them by calling this number, 866-717-5826, which is available Monday through Friday from 8 a.m. to 11 p.m. Eastern Time.
That's very good, Rachel. Ramya, let's talk about what kind of documents they need in order to process an application.
An additional document is required that must be copied and included in each application process to verify your medical condition and denial of health coverage. It can be a letter from your doctor, physician assistant, or nurse practitioner dated within the past 12 months that verifies your medical condition, illness, or disability. A denial letter from an insurance company for individual insurance within the past 12 months is also acceptable. A letter within the past 12 months from your insurance agent or broker licensed in your state that you have been denied health coverage due to medical conditions is also acceptable.
Rachel, let's tell the audience again, what's the best way for them to get more information about this particular program?
Well, you can start by going online to www.pcip.gov in order to apply, or also for more information regarding this. They also have a section for frequently asked questions that you may have your question answered on. And you can also call them at 866-717-5826 from Monday through Friday at 8 a.m. to 11 p.m. Eastern Time.
Thank you, Ramya and Rachel. This community awareness project has been brought to you by Sugarland Heart Center in collaboration with Rachel and Ramya from Hightower High School Medical Academy. If you want to get more information, you can contact us at drnikam@gmail.com, or you can call our office at 281-265-7567. Thank you.